Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. The information provided in this program is to assist you in exploring all available options to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. Now, in this recording, we will be looking at the first few days, what to expect, and I've highlighted it for you on the list of topics we are covering in this breastfeeding class series. Today's recording is going to be a little longer than the others. Okay, right. From the baby's side, after birth, the baby expects things to continue like it did in the womb. Baby was never hungry. Um, During the last weeks, a baby in the womb swallows up to 400 ml of amniotic fluids in 24 hours. Anyway, also in the womb, the baby hears the mother's voice, heartbeat, and breathing, sounds of the blood rushing through the placenta, white noise that soothes the baby. Baby is also rocked to sleep and kept warm and feels safe. And skin to skin contact after birth is as close as the baby can get to the womb experience. So try to stay skin to skin with your baby as much as possible because it will help the baby's transition to this outside world. Now, what do you think? In the early days and weeks, how often and for how long do babies breastfeed? And should babies be fed on demand or on a schedule? Now, the optimal feeding pattern is unrestricted feeding and responding to the baby's needs, though not having guidelines can make it difficult to navigate this uncertain and unfamiliar time. So, to be more specific, newborns need to be breastfed on average 8 to 12 times in 24 hours. So, this sounds like 2 or 3 hourly, but a baby has no concept of time. So, watch the baby, not the clock. Now, some parents say they read in a book how long they should feed a baby per breast, but a baby didn't read the same book, and the baby doesn't know what their parents think is right. The baby acts on instinct to show that they are hungry, and breastfeeding is a relationship. It is so much more than just food. So, ideally, you do not have to follow a feeding schedule or wait a certain length of time or follow a clock to decide when it is time for the next feed. So no need to set any time limits on the number of feeds in 24 hours, and also no need to feed a baby for any fixed length of time per feed. And this includes setting a time limit for each breast or a certain amount of minutes per breast. Nothing like that. Now, I will explain why later. Now, newborns' breastfeeding patterns, how often they feed, it varies from baby to baby and from day to day in an individual babies. Some babies would space their feeds closer together, called cluster feeding, at certain times of the day, usually during the evening, meaning they may want to breastfeed continuously for several hours and then they sleep for several hours. Now, during the first few days, many babies may breastfeed more at night and less during the day because their mothers have been rocking them to sleep for 9 months during the day. And most mothers will recall their babies in utero waking up at night when the mother got into bed. And then she would have felt her baby kicking and moving more. So babies are still in this rhythm of being more awake at night and sleeping more during the day. And most babies switch by 2 weeks of age, just eating and sleeping at night and being more awake between feeds during the day. Now, sleeping longer stretches at night may be a pattern seen after 6 weeks of age. So, if a baby is sleeping all night in the beginning, the baby is probably not getting enough calories. So, gently wake that baby and offer the breast if the baby sleeps longer than 2 or 3 hours since the start of the previous feed, or if your breast feels too full. So, respond to signs a baby wants to feed. And what are these signs? Feeding cue signs: baby wakes up, baby roots, makes little noises, making hand to mouth movements, sucking movements, licking lips, sticking out the tongue, drooling, sucking fingers. And then remember, crying is a late sign of hunger. How often and how long? Let the baby suckle as long as the baby wants, provided that the baby is effectively attached to the breast. So the length of feed can vary from different mothers, between different mothers and babies, and it can vary according to the baby's hunger from one feeding to another. So the efficiency of babies feeding usually improves as they grow older. So feeds won't necessarily always take 40 minutes in the beginning. Now, usually when a baby has had the milk that they want, they will release the breast, and ideally you should not be taking the baby off the breast before the baby is done. If you take the baby off the breast too soon, they may not get a complete meal with the fat that they need, and they might be less satisfied and they might be hungry sooner. So let them come off the breast by themselves, not taking them off before they're done. And once the baby has finished feeding on one breast, you can offer the other breast. Some babies may only feed on one breast per feed, especially when the milk supply is high in the early weeks. So it's not necessary to feed a baby from both breasts at each feed. If a baby doesn't want the second breast, you can offer that side next time. So this way, both breasts gets the same amount of stimulation over 24 hours. As a guideline, during the early weeks, very long feeds, like more than 45 minutes for most feeds, or very short feeds, less than like 10 minutes, or very frequent feeds, more than 12 feeds in 24 hours on most days, and the baby not gaining weight. That may indicate that the baby is not effectively attached at the breast, or that there might be a supply issue or a milk transfer issue. So get help from someone trained in breastfeeding support. And for a baby gaining weight as expected, these feedings could actually be normal. Um, though we could also peek in the nappy to give us a clue to the fat in the milk and oversupply, etc. Okay, let's take a quick look at what you can expect in the early days. Day one. On day one, in a perfect world, a healthy newborn is given the opportunity to stay skin to skin with their mother immediately after birth, which is a time when normal, non medicated term babies are most alert. And ideally, the baby will have their first introduction to the breast. And also, in a perfect world, the baby will get only colostrum, and it's easy for the baby to breastfeed on their mother's soft breast. And ideally, the baby will stay skin to skin with the mother and feed as often as they want. Now, in the first 24 hours of life, newborns are often very sleepy, and some babies may only feed 5 times, and others could feed up to 12 times. But how often a baby feeds may be more dependent on skin to skin contact at birth and rooming in. Now, guess who fed 5 times and who fed 12 times? Obviously, the baby in skin to skin contact is the one that fed 12 times. So on day one, parents will also notice baby having a wet nappy and also passing meconium. Now, meconium is that first stool baby passes. It's a sticky, dark green substance composed of water and solid elements of swallowed amniotic fluids like lanugo. That's the fine hair you will find on a baby in the uterus, mucus, as well as intestinal epithelial cells and intestinal secretions like bile, etc. So a newborn baby also loses some weight as they adapt to the outside world. Now, this slide shows the size and the volume of a newborn's stomach. Now, as you can see, a newborn's stomach is very small at birth and it cannot hold much milk. So the stomach capacity varies with the birth weight of the baby. So we cannot say that each baby's tummy will hold exactly 5 mils at birth. The bigger baby's tummy might be able to hold more. So 5 mil is kind of just an average. Now, colostrum is complete, and newborns need only small volumes of colostrum in the first days of life. So, colostrum is perfect to fill the tiny tummy, and it's thick and it's easy for the baby to coordinate sucking, swallowing, and breathing, which we mentioned in a previous recording. Now, on day two, or 2 to 3, the frequency of feeding increases, but there's some variation. Ideally, the mother has no nipple pain or breast pain while the baby is feeding, and the colostrum baby receives helps to flush out the meconium. Now, feeds may increase to 10 or 12 times in 24 hours, or like every hour to 3 hours in the first few days, but it might be more frequent. And newborn babies tend to breastfeed more frequently during the first week. Their tummies are really tiny and breast milk digests very quickly. Now, the feeding pattern may be completely different during the second week of life. So just keep that in mind if it feels like you're just feeding nonstop. Anyway, some parents have this image of an ideal baby, and then on day one, usually, the babies are good sleeping babies, but then on day two, everything changes. So the baby might be upset before the milk supply increases. They just want to feed all the time. Um, but that frequent feeding is driving the increase in milk supply. So the demand for feeding is normal and healthy. So I think the baby misses the womb. And as I said before, the breast is a womb with view. And being skin to skin after birth is as close as the baby can get to the womb experience. So just stay skin to skin with your baby. And please don't be tempted to give the baby a dummy if the baby is too demanding or demanding more attention. Um, Now, why am I saying this? What do you think is the risk of using a dummy or a pacifier or soother or whatever you want to call it? Now, step 9 of the WHO 10 steps to successful breastfeeding says counsel mothers to the on the risk on the use and risk of feeding bottles, teats, and pacifiers. Now, pacifiers may interfere with the mother's ability to recognize feeding cues, which are a baby waking up, being more alert, turning head, making hand-mouth movements, sucking, etc. Also, um, if a hungry baby is given a pacifier instead of a feed, the baby suckles less at the breast and they take less milk and they may not gain weight as well. So, as a result, it interferes with establishing of milk supply. Babies who use pacifiers, research shows they breastfeed less in 24 hours. Now, one of the reasons is suckling secretes cholecystokinin, which makes the baby think they are full. Now, if you don't know what cholecystokinin is, it is a gastrointestinal hormone that enhances the feeling of satiation and well-being and sedation, etc. The that sleepy feeling that you get after eating a nice meal, that's due to the cholecystokinin secretion in your gut. Now, in a baby, vagal stimulation during suckling causes cholecystokinin release, and that produces a sleepy feeling in the baby. So this might explain why fresh newborns will often fall asleep at the breast after about 20 minutes of suckling when the cholecystokinin levels have risen. And then parents might put a baby down, thinking that the baby's done, and then 20 minutes later, when the levels have fallen, the baby wakes up convinced they've never eaten before. And then the levels peak again 30 or 60 minutes later due to the milk then entering the baby's guts, triggering the cholecystokinin release. Now, because suckling causes cholecystokinin release, suckling on a dummy might make a baby think he's full and then breastfeed as well and possibly have a negative impact on the baby's weight gain. So just FYI, cholecystokinin in human milk makes it perfect to soothe a baby during a painful procedure like immunization, etc. So breastfeed a baby when they are undergoing a painful procedure. Now, pacifiers should not be used at least until breastfeeding is well established, and this is about after 4 weeks of age. And then be cautious regarding the hygiene because pacifiers can carry bacteria if they're not cleaned regularly, and this could lead to an increase in ear infections and dental problems. And also, long term use of dummies can lead to dental problems like pacifier teeth or open bite. This is a misalignment um, where the teeth are angled outwards and may not close. And then, very interesting, pacifier use during childhood is positively associated with smoking initiation in adolescence and early adulthood. The study noted a statistically significant association between prolonged pacifier use, like more than 24 months, and smoking. Okay, carrying on. So all babies' meconium should or will be passed by 48 hours, and then after a few transitional stools, perhaps another 24 hours, the stool becomes yellow around day 4. Now, most of you might have seen this chart where We previously thought that the increase in frequency and change in color of a baby's stool, as indicated on the chart, is a good indication of intake. But findings suggest that diaper count on day 1 and 2 is not a reliable enough indicator to serve as a screening tool for breastfeeding. So, where we thought one poo nappy on day 1 and 2 on day 2 and 3 on day 3, etc., um, that's out. Babies are going to poo and pee on day 1 and 2, regardless of not taking enough milk. The correlation between baby's intake and output is more reliable after the first 3 days. So, oh, and then after a month, people thought skipping days between poo nappies is normal, but it's not. It's actually a sign that the gut isn't functioning quite as well. So it's uncommon for babies gaining appropriately to stool infrequently. The take-home message here is that as an indicator of effective breastfeeding, we want to see yellow, seedy bowel movements by day 4. Okay, day 3. By day 3, the milk supply usually increases and it changes from colostrum to mature milk. The mother's breast feels full, ideally not engorged, and we'll talk about engorgement in another recording. And as the feeds become larger, because there's more milk now, there may be or may not be longer intervals between feeds. But the mother should still feed the baby as often as the baby wants, and usually by day 3 onwards, the baby will be feeding on average 8 to 12 times in 24 hours. Again, this sounds like 2 or 3 hourly, but the baby has no concept of time, so watch the baby and not the clock. If the baby is very sleepy, encourage the sleepy baby to wake at least, to feed at least 8 to 12 times in 24 hours. And just keep that baby close. A baby who rooms in with the mother, who responds, gains more weight over the first 7 days. And as mentioned, the newborn usually loses some weight as they adapt to the outside world. Weight loss is usually less than 7% in the first 3 or 4 days. A weight loss greater than 8% might be a sign that breastfeeding needs to be evaluated, keeping in mind that intrapartum IV fluids that the mother receives during labor, that can cause a baby to be born with an inflated birth weight, and then there's a greater fluid loss after birth, which with a significant weight drop on day 1. And you'll know this by seeing that the baby is soaking nappies on day 1. Then you know baby's just excreting all that extra fluids. Okay, now that the mother's milk supply has increased, an indicator of effective feeding is a baby who has stopped losing weight and started to turn around. So we don't want to see any weight loss after day 3. On day 4, now that there's more milk as well, but this you can actually see this from day 1 as an indicator of effective and comfortable breastfeeding, is our audible swallowing from during feedings. So baby's also satisfied and content after feedings. The baby may still feed 8 to 12 times, even 15 times over 24 hours, which may be 2 or 3 hourly apart, and the length of the feeds will vary throughout the day, from short, sometimes clustered, or a series of snacks, or business-like, or leisurely, or prolonged. And babies may be falling asleep towards the end of the feed, or at least be content for a while before feeding again. And they will have limped, relaxed hands and an unworried expression most of the time. And also, a mother's nipples should not show any evidence of damage, and her breast fullness should be relieved by breastfeeding. So please contact the breastfeeding specialist if you have any concerns about your baby's breastfeeding. And then, as mentioned, another indicator of effective breastfeeding are yellow, seedy bowel movements, at least a few in each 24 hours after day 4. And if there's a lack of bowel movements in the breastfed babies, that is a key indicator of inadequate calorie intake. So the stools are usually loose and seedy and soft and unformed and yellow colored. Sometimes there's an occasional greenish bowel movement. Um, And I think I have mentioned that over the first month or so, a breastfed baby should have a few stools every day. Now, um, breastfed babies have a strong gastrocolic reflex, so they tend to have a stool with each feeding. Gastrocolic reflex is a physiological reflex that controls the motility of the lower gastrointestinal tract following a meal. So, as a result, of this reflux, the colon, has increased motility in response to the stretch of the stomach with the ingestion of food. So, meaning babies want to poo after each feed. So, how do we know things are going well? Baby is gaining weight as expected, the feeding is comfortable, and the excess is excreted in the nappy. So by day 5, we want to see weight gain. We want to see lots of yellow poo nappies, and the mother shouldn't have any pain while feeding, and feeding should relieve her breast fullness. By day 6 to 7, if breastfeeding is going well, a mother's breast should have settled and the baby's weight increases nicely. And a newborn usually signals to feed every 1 or 3 hours, timed from the start of one feed to the start of the next. And baby has at least a few yellow poo nappies in 24 hours. And then babies should have regained their birth weight by 10 days or 2 weeks. If baby doesn't regain their birth weight by 2 weeks, this could be a sign that breastfeeding needs to be evaluated. And expect the baby to gain weight steadily following the path on the chart of the Road to Health booklet. And an average weight gain is roughly 30 to 45 grams per day, but a baby may gain somewhat more or less. And most babies will have a poo nappy with almost every feed. And ideally, breastfeeding at this point is also going well, and the baby is feeding comfortably 8 to 12 times in 24 hours, and the mother has no pain, and she also has no nipple or breast pain. And then I've mentioned this before, babies could perhaps start sleeping longer stretches after about 6 weeks. So, sleepy baby. Talking about sleep, what if a baby is too sleepy to feed? What should you wake the baby? Now, I think I've said this again already today, but if a sleepy newborn doesn't wake to feed, a mother might need to leave the feed for a few days and encourage the baby to wake and feed at least 8 to 12 times in 24 hours. And here are some ideas to wake a sleepy baby. Stay skin to skin with the baby as much as possible. And when the baby wakes from a deep sleep, if they're skin to skin, they can smell their mother's milk, and this might stimulate the feeding cues. And then respond to those cues immediately. If there's heavy blankets on the baby or heavy clothing, remove that so the baby can move their arms and legs. Sometimes undressing a baby may help to awaken a sleepy baby. And express some milk directly into the baby's mouth, or express some milk onto a finger or teaspoon and wipe it on the baby's gums. That might help. Sometimes it helps to change the baby's nappy to wake them up. Sitting the baby upright might help. You might have noticed this called the doll's eye phenomena. When you're lying the baby back, the eyes close, and when you're sitting the baby up, the eyes open again. And most babies exhibit this. It's an unsuppressed doll eye reflex before 11 weeks. Okay, also talking to the baby with a variable pitch may help. This is called parent tease. Maybe put the baby's hands to their mouth, or gently stroke the baby's face, or gently massage the baby's body, stroking the palms of your hand or the soles of their feet. But please, please, please avoid hurting the baby by flicking or tapping on the baby's cheeks or feet. All right, so after 2 weeks, once breastfeeding and the milk supply is established, babies vary in the number of feeds they want, which may still be anything from 8 to 12 in 24 hours. And the time between feeds also vary from less than an hour to several hours. Now, studies have shown that healthy exclusive breastfed babies between 1 and 6 months old drink anything from 0 to 240 mils. Anything from between 6 and 18 times in 24 hours. And at 6 months, a baby can still be feeding up to 3 times a night. So that is okay. We also expect the baby to continue gaining steadily following the path on the chart in the Road to Health booklet. And most babies will have a poo nappy with almost every feed. And there might be a decrease in frequency, but an increase in volume of poo nappies at about a month. But ideally, the breastfeeding is going well, and baby is feeding comfortably, and the mother has no nipple or breast pain. So I have said how to know that things are going well is baby's gaining weight as expected, feeding is comfortable, and the excess is excreted in the nappy. So what now if baby is suddenly feeding nonstop? Now, you might have heard of growth spurts or frequency days. Now, during periods of rapid growth, babies may be hungrier than usual and feed more often for a few days to increase milk production. And these periods of a few days of increased breastfeeding, which are anecdotal growth spurts, they may occur roughly every 2 weeks. So this is not research based; it's anecdotally observed in practice. Um, so a baby is probably going through a growth spurt around 10 days or 2 weeks, 3, 4 weeks, 6 weeks, 12 weeks, for 2 or 3 days when a baby is hungry, feeds nonstop, doesn't settle, like cranky, clinging, crying. You can't put them down. They're only happy in the parents' arms. They will only sleep when they are held, but they are overall growing well, pooping well. They don't have a fever and they're not ill. So just follow baby's cues and feed the baby when they ask and hold them and rock them and love them and just help them get through the growth spurts. Now, sore nipples are a result of ineffective or shallow attachment, not the result of feeding too often or too long. So if a baby is effectively attached, it doesn't matter if the baby is feeding often or for a long time. But please see your baby's primary healthcare provider if you are at all worried about your baby. Now, if you don't know this by now, maternal milk production of an exclusively breastfed baby between 1 and 6 months old is on average 750 to 800 mils a day. So the amount can range anything from 440 to 1,220 mils per day in a baby who are growing within the normal range. More recent reviews showed that breast milk intake increases rapidly over the first month, from 45 to 620 mils a day. And then it reaches a plateau kind of at 3 or 4 months, just below 750 mils a day. And then it starts progressively decreasing with the introduction of solid foods around the middle of the first year. But the bottom line is the baby is building the milk supply over the first few weeks. And then when the baby is doing well, weight wise, around a month, and pooing a lot because they're just pooing up the axis, you know you are set for 5 months, provided the baby continues to take out the milk. So the baby builds the milk supply in the first month and drinks the same volume from 1 month to 6 months. Amazing. Anyway, after about 3 to 6 weeks, some babies start to poo less, but the stools are still loose and seedy and soft and unformed and yellow colored, and occasionally there's that green one. Um, and as I mentioned, the notion that babies may pass stool only once every few days, that is outdated. Skipping days between poo nappies might be statistically common. Although it's not usually nothing to worry about. It could be a sign that the baby's gut motility is a little sluggish and the gut function isn't working quite as well. And the research shows 94% of babies between 1 and 6 months have a bowel movement once a day, which are usually large and semi-liquid. So let's quickly talk about two of the most common worries of new parents in the early weeks. And the worries are, is my baby getting enough milk? And do I make enough milk? So often, when a mother worries that she doesn't have enough milk, her baby might actually be getting enough. And this is called a perceived milk insufficiency. So babies who are not getting enough doesn't necessarily mean that the mother is unable to produce enough. Maybe the baby's not getting enough because they are not suckling enough, or they are ineffectively attached. And a baby who is chronically underfed, who is not gaining weight, becomes a weak, ineffective feeder, and they may lose their appetite and then feed sleepily. And this leads to an inadequate milk transfer, and then in the mother's side, a compromised milk production. And these babies need assistance to gradually take in more milk and then begin regaining weight. Some babies just need some time and calories before they can feed effectively. And we'll talk about this in a separate recording again. So what we can do is as easy as ABC. See a breastfeeding specialist who can help you with checking baby's positioning and latch and milk transfer. See if we can get baby to feed more effectively at the breast, finishing one side before offering the other one. Maybe do some breast compressions, staying skin to skin with the baby, and depending on how long this has been going on, check if it works in a day or two. And perhaps if the baby wasn't stimulating the breast enough over a period of time, this might have now led to a down regulation in your milk supply, and or maybe the mother is really not producing enough. In any case, if this has happened, the mother needs to build up her milk supply again, which brings us to B, breast milk. So make sure the baby is stimulating the breast often enough. Um, it has been said that the most important factor in establishing successful breastfeeding is the volume of milk produced in the first 2 weeks. So it's a very important part of establishing a good milk supply is frequent milk removal from the breast during the early weeks. And if you can remember from an earlier recording, if there's a demand, the body will supply. Demand equals supply, unless there are other factors at play. Um, so please see an IBCLC to help you with this if it's needed. And then C, calories. Um, Make sure the baby is fed often enough or long enough, so the baby can get the calories that they need. Now, just in case you are interested, weight gain is the acid test that the baby is getting enough to eat. So the suggestion is to have a baby weighed weekly from birth to 6 weeks, and then every second week from 6 weeks to 3 months, and then just monthly after that until a year. Now, there are separate road to health charts for boys and girls. Boys are slightly larger than girls, so the gender specific charts are used for boys and girls when plotting their size for age. Now, the growth charts in the Road to Health booklet and most international charts for children um, have 5 growth lines drawn on them: +3, +2, naught, -2, and -3 lines. The naught line is green, and the +2 and -2 lines are orange. They're also called warning lines. And the +3 and -3 lines are red, and they are called danger lines. So about 50% of healthy children will fall above the 50% and above the naught line, and about 50% below the green line. And most children grow or between the two orange line, but regarded as having a normal, average, or appropriate body size for age. Now, we want to see a baby following the path or lines on the Road to Health chart. So ideally, um, the clinic sister needs to plot it on this chart. Make sure she does if she weighs a baby, because this is a really nice and easy way to see that the baby is growing as expected. And this is just a summary. Again, babies may lose up to 7% of the birth weight, lowest weight usually around day 3. Um, and then by between 10 days and 2 weeks, babies regain their birth weight and then gain an average about 30 grams a day. Keeping in mind some babies may gain more and some less. And then about 3-4 weeks, baby gains on average 240 to 270 grams a week. By 2 months, it starts to slow to 210, 300 grams a week. And you can see the chart on the chart as well that the growth slows, because by 9 months to 12 months, the average gain per month is maybe 120 to 390 grams per week. Okay, this was a long one. Thank you for watching this recording. In the next recording, we will look at the position of the mother during breastfeeding. And please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the breastfeeding class notes. And you can also navigate the class recordings easier from the website. And feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.